Hello, I'm Kevin Sylvester, and pleased to be sitting by Dr. Frank Aiello, a founding mentor of Mini Implant Mentors. Dr. Aiello, good to have you here.
Thank you so much.
I'm curious what it means to you to be a Mini Implant Mentor.
Well, first of all, it's an honor that I never expected. When I started doing mini dental implants, I was just trying to find another service to do for my patients that gave me more excitement, try to reinstill some more passion for me to be a dentist after my partner retires and I'm left holding the bag. So never in my wildest dreams did I think that it would grow to the size and proportion, not just with the procedures themselves and be able to do those procedures for my patients, but the people and the colleagues and the friendships that I've developed along the way that share that same passion. And now we have this wonderful group, this mentoring organization to keep it going and allow it to grow, because the ultimate goal is to help more people that are suffering, who just simply can't eat. And now we're there.
You know, the word mentor, and you know, any walks of life, mentors are great to have, right? They lend the advice, the experience.
Right.
So if someone watching this is an up-and-coming dentist, if you could give them a piece of advice right now, what would you give them?
Be committed. Don't quit. No matter what we do in life, when we start any career, we're not successful totally out of the chute. I don't know anybody that hits 100% from day one to day whatever. Mistakes are made. We learn from them. We know that. The point is that we were taught never do any harm to our patients. But we go through trying to do the best that we can. When things don't go right, have a plan B. Satisfy the needs that that patient is required, but sometimes things just don't work out. Don't get discouraged. Learn from that. Help the patient get through it. And the next time out, you're going to be better and better and better and better. And eventually, you wake up one morning and you become a mentor, like me. Just amazing. But that's my advice.
Let's talk about the implant industry specifically here, and if there are any changes that you'd like to see occur in the implant industry.
I would like to see a lot of changes. When I first started in dentistry, I just did whatever I could to be proficient in general dentistry, because I am a general dentist. And that was hard enough. And then you go out and you start taking continuing education courses. Okay, what other services can I offer my patients? And implants was difficult. And there is a culture out there in dentistry that my colleagues are aware of. Patients and consumers aren't aware of this, but in certain industries there are those biases and prejudices in the industry themselves. So you only know what you know. And what you don't know, you either go and learn it or you condemn it because you don't know it. And that's not fair to anybody. And that's what we have to change in our industry. If you don't know it, go and learn it before you pass judgment on it, because you could be shortchanging a patient from a service that could change their lives, including yours. And without getting too specific, the industry is just too variable in the products that are out there to use to restore dental health for our patients. It needs to be uniform. We all have to come together and say, okay, this is going to be the standard, and not all this mishmash and trying to figure out what part do I need for this implant. I don't even know what this implant is. What part do I need to help this patient who came in whose doctor just passed away but never finished the implant? These are the challenges that we are faced with. So I find myself now being a fixer, trying to help people who have these situations, and it's very difficult to fix them. So if there's anything I would like to see changed in the industry, it would be that standardization.
Yeah, there are some, particularly younger dentists who are anti-mini dental implant. Is that lack of knowledge and understanding? Do you think that's why they are?
Thank you for paying attention. Yes, of course. It starts in the dental school. So you have to consider, who are they learning from? Are they learning from someone who has a broad perspective of wanting to know everything that's out there? Or are you being instructed by someone who is only teaching you what they learned 3 generations of dental schools? So we never get ahead. We never find out what else is new. And unfortunately, we allow the manufacturers to introduce what's new and not the doctors. And that's a shame. Not that the manufacturers don't do a great job. I love it. But we should have more control of what's introduced into the dental schools and not have that bias and false perceptions of those new procedures and techniques.
Hardest part about being a mini implantologist? What's the hardest part?
Wow. I think the hardest part in those procedures is people are coming in with expectations that nobody can meet for them.
Sure.
And that's what's difficult. And they come to me, other dentists like me, and they're at the end of the road. They've gone everywhere. They've been turned down. And now you're faced with a situation of, if I don't help this person, their life is not going to be ending very well. Mm-hmm. I have to try to find a way to help fix them. So now, am I giving them the right expectations? Can I really help them? That's what's difficult. Do I take this case on, or do I turn them away like everyone else has? That's what's the most difficult part of my job.
Sure. Which you don't want to do, obviously.
Exactly.
You're there to help somebody.
Exactly.
For sure. Well, that being said, you've probably seen a lot of cases, people of all walks of life come through your door. What's the craziest thing that you've come across in the industry that you've seen?
Oh, wow. The cases that we end up fixing, that supposedly we're not capable of fixing. I've seen implants placed horizontally. I don't know how they do that. They look like a cannon coming out of the ridge, from the Battle of Waterloo. And and these poor people, they don't know what to do. So you see these situations, and when I look at that, I see what I talked about before. Lack of knowledge, not being trained properly. The patient doesn't know, and that's who I worry about the most. Because any consumer, they don't know. They only know what they read on the internet, maybe what another doctor told them, maybe what their neighbor told them. They come in, why should they trust me or any other dentist? It's very difficult, and I feel bad for the consumer. So I try to establish that relationship with them, no matter what's there, because they're coming in with some crazy stuff that's not working. What makes them think that I can fix it? I don't know. I just feel fortunate that they're in my office and they chose me to try to fix up what was in there. And, it's just too involved to be able to show you what I've seen. So I don't pass judgment on anybody. So I don't expect to have judgment passed on me. I don't know if I answered your question.
No, I'm going to beg to see that picture, the horizontal one. That sounds fascinating. Clinical question here for you. Placing an implant in the maxilla. Tell us your thoughts on this.
That's the area of perception from the industry that can be misconstrued. Because doctors, if they don't know enough about these implants, they're not going to accept those techniques. But the conundrum is, where do these implants come from? They're coming from the same implant manufacturers that are making the same implants that they're using. So if the manufacturer is making these implants and selling these implants, you're okay with learning what the manufacturer is showing you now. Why aren't you wanting or being interested in learning from the manufacturer these other types of implants, what's the roadblock there? Good question. I think it's lack of knowledge and biasness and prejudice, and it is profit motivated. So, unfortunately, in our industry, it does exist. What sells the most and who's pushing it the most? You know, I tell my patients this story. What is the difference? Why do you use the minis and why does the other doctor not use them? And there's more detail to that because you want to be able to use the right implant for what you have to work with. So, and it's like this. If you wear a size 9 shoe and you go to the shoe store and the shoe store, okay, only has size 6s. But you know what? You're not walking out of there until you buy a pair of size 6s. So that is the conversion. It's trying to force an item to solve a person's problem, so you change the jaw to match that shoe size, which involves more surgery, bone grafts, screws, cadaver bone. My 90-year-old patients aren't up for that. They need a softer, kinder, less invasive solution. So that's what we offer. And we're not saying as mentors that know these services. I choose to do these services because I want to be good at something that I know that I can deliver with consistency to these group of people. I'm not out there doing work that can be done by other doctors. But as far as putting mini implants in the maxilla, just like I said, if in the front you only have a size 6 shoe, you got to use a shoe that fits that size 6 foot. You try to use a size 10, you need a bigger foot, right?
Yes.
So how are you going to make a bigger foot? Patient doesn't want a bigger foot. This is my foot. Give me a shoe that fits my foot, right? So in the front, you use a mini implant because it fits in there very nicely and it works. As you gain larger bone towards the back, you use a larger implant because I have a size 10 back there. So I'm going to put a size 10. So I got a caterpillar walking out of my office, okay, with different size shoes, all right? What can be better than that? So yes, the answer is yes. Why did I take so long to answer
that's
that
all right.
question?
I feel like I should have some kind of you didn't put your foot in your mouth answer to that question.
There you go.
What do we look for in a lab? What should we look for in a lab?
Wow, I was just asked that. One, consistency, reliability, trust, because this job is not easy. It's hard. Everything is different. Every patient is different. Every side of the mouth is different. Sometimes things just are very, very difficult to achieve in somebody else's mouth. One, personality, anxiety, sedation, no sedation, big fat tongue, a lot of saliva. You know, you try working in that kind of environment. Dentists have a hard job. Okay, all right, I'm doing a sob story here. But the point is that the lab tech doesn't know what you're going through. They need to know that. You know, we just had a session this morning with our lab. 3 hours, just interchanging our frustrations, only because of lack of communication.
Sure.
Key, get together with your lab one-on-one. You can call, you can get online, but you know what? We were just talking about that. You need a face-to-face. You need to be together. You need to see what each other are trying to accomplish for that patient. Better outcome. And then you have that consistency because everybody knows what to expect.
Yeah, in this day and age, if we're putting everything in online, the specs, it's always good to be able to pick up the phone and talk to somebody that you know and knows you, right?
Right,
knows
exactly.
how you like to work. What implant system do you use?
I use quite a few. Like I said, I try to go out and learn what I don't know. That's why continuing education is never ending. You graduate from dental school, it's just the beginning. That degree just gives you the opportunity to go out and now you start to learn, not the other way around. So if you don't have continuing education on your plate, you're never going to be successful in our profession and a lot of professions. You have to go out and find out what other doctors are doing in the field. You're in this isolated cube environment being told certain things just to get you out of the gate. Now you go out, find a mentor, and I've been told this by other people, that you admire, who is very successful, and you mimic them, and then you create your own style. But if that is an example of success, why wouldn't you want to learn from that?
Makes
You'd
sense.
be surprised how many people don't want to learn success because they think they already know it. But that's what we're trying to do in being mini dental implant mentors, is that there's more to just the mini dental implant. We have other implant systems, but what we profess is one piece. That is the only difference, okay? Because the diameter of the implant can vary to the same size of the so-called traditional implant. It's just one piece. That means we don't use a hollow implant. And the reason why it's big is because it has to be hollow. Why does it have to be hollow? Because you have to use a screw to tie the crown or the undercrown into that implant. That's a two-phase system. It's a great system. I've had great success with that. But screws get loose, screws break. And I'm not saying that there aren't any failures with mini implants or larger diameter single one-phase implants. We all have failure for whatever reasons. There's many reasons why. But I think that I would rather use a solid titanium implant than a hollow one. If you had your choice, most consumers would say, it makes sense that it's solid and is not hollow. That's why we use different systems, but I prefer to use the single placement, single one-phase type of implant of any size, depending on the size shoe that walks in the office, okay? And that's what I use. And there's a ton of them out there. There's one, without naming manufacturers, that's bendable, that looks just like a traditional implant. And in the anterior area, you can bend it to your angle, and it's beautiful. And it looks just like a traditional. And it's a larger size, too. Not necessarily a mini.
I was told to ask you this, and I assume this is a fun question. They said I better ask Dr. Frank this. Pancakes or waffles?
I prefer waffles with chicken.
Oh, well, of course.
Yeah.
Syrup? Syrup with that, too?
A little syrup, but chicken and waffles is my favorite.
Chicken and waffles is good, okay. And final thing I want to ask you, who are... Hey, sometimes I just deliver the questions.
I know, they just give you stuff to read, right? I know.
Well, somebody come up with but three people in your life that made your mini implant journey possible.
Well, you know what?
And don't say me, myself, and I.
No. No. You know who it was? When I thought hard about that question, immediately I thought, well, the people that taught me how to do those procedures. But no, that's not what it was. It was the people that prepared me for life. My football coach, my mom and dad. Those people throughout my years, those are the people that shape your life.
Yeah.
That make you achieve those challenges and accomplish what you accomplish. Those are the people.
What was your football coach's name?
Mr. Shesman.
Mr. Shesman.
He lived right down the street.
And your mom and dad?
Well, Ada and Sam, of course.
Yeah.
Yeah. And, my track and assistant coach, Pete Cristo. Pete's my patient.
Is he?
Yeah. God bless him. He's 80 years old. He still comes in. And we talk about the old days. We talk about the games that we should have won.
Sure. Well, it sounds like you had great folks raising you and great mentors in those coaches.
Absolutely.
And that's why you're going to make a great mentor.
Well, thank you. I appreciate that.